Can you hear now?
Yes.
There we go. Okay. First of all, again, I want to encourage anyone who's standing in the back to please come take a seat. I'm sorry that we do not have enough seats for everybody, but God does answer prayer, because this is exactly the kind of turnout that we were hoping today to demonstrate just how important LSU Health Shreveport is to our community. My name is Lisa Babin, and the Director of Communications and Public Affairs, and it's my joy to bring to the podium at this time our Chancellor Dr Ge Ghali.
Thank you, Lisa. Hope y'all can hear me okay. It's really my distinct honor to be here today, and I'm really warmed by the number of folks that are here. It really speaks volumes to the importance of our Health Science Center, and not just as an economic engine, but more importantly, taking care of what our mission is as a safety net hospital and health science and academic medical center. I also want to thank Commissioner Dardenne and Undersecretary Jeff Reynolds, who are here today to help answer questions from an administration standpoint and from the standpoint of the Louisiana Department of Health, which is really the largest single budget area of our entire state budget. So these guys have taken out of an incredibly busy schedule to be here. And before I have them come up to make some comments, I want to make a few remarks myself. Again, I want to thank everyone for coming today to show your interest in the future of LSU Health Shreveport. We find ourselves in a rather unique position. On one hand, we're certainly what I would say we're on the cusp of having a new hospital partner, which stands ready and able to bring enhanced patient care and even more robust medical education to our community. On the other hand, we recognize that our state funding for the upcoming fiscal year, which starts July 1st, is not yet at a point that we view those funds as being stable. Our goal today is to make sure you, as concerned citizens, know what is at stake if our institution is not adequately funded. While we are deeply grateful to the Senate Finance Committee for choosing life as a priority for funding by eliminating the previously proposed cuts to Medicaid funding, we do not know if the entire Senate will take the same position. Therefore, we're choosing to be forthcoming and transparent, as we always should be, about the impact of our Health Science Center and community if adequate funding is not ultimately provided. The reality is there are not sufficient funds currently available to meet the basic needs of our state citizens, and we are absolutely not in a position to sustain any additional cuts to the current level of funding without decreasing services, period. While the Senate Finance Committee approved a budget that restored funding to the public-private partnership, the 24.2% cut that everyone has heard about that resulted in every other state department creates a ripple effect, as many of the state departments that we interact with will be decimated, creating a new set of problems. Let me be clear that we're very grateful to the Senate Finance Committee for recognizing that funding the Health Sciences Center and safety net hospitals will result in the sickest of sick, our most vulnerable citizens having nowhere to go for care, and will also further impact the current healthcare worker shortage. Not only will citizens with Medicaid have little or no choice in where they can obtain health care, but so will thousands of patients who require highly specialized care found primarily in areas like fortunate to have in Shreveport-Bossier. In our community, those highly specialized services that will be in jeopardy being discontinued may include things such as the Level 1 Trauma Center, only one of two that we have in our entire state, accredited both in pediatric and adult trauma. A burn unit. There's only a couple of burn units in the entire state of Louisiana. We're fortunate to have one of those. Bone marrow unit. The Gamma Knife, which we have the only one in the state of Louisiana. Viral disease clinic. Poison control center. And I could go on. Primary stroke center, and go on. And that doesn't even include our research, which is so vital as well. So without further ado, I'd like to ask the Honorable Dardenne to come up here. And I think he has a few opening remarks that he'd like to make. And then I would, everyone's taken out of the middle of their busy day to be here. And so I think it's important to have question and answer session. I think this is what this is all about. And this is for our community. I'm not here to tell anybody how to vote one way or the other. I'm only telling you the consequences of if you vote one way or the other, what the consequences will be in our Health Science Center, and they will be devastating. Commissioner Dardenne.
Thank you, Dr. Ghali, and thank all of you for being here today. And I want to also thank you for giving me a great opportunity to get out of Baton Rouge and out of the Capitol today. It's a beautiful day, and I'm glad to be with you and trying to answer your questions. The Senate, as we speak, is debating the budget bill. So we literally are having this discussion at the same time that the Senate will be talking about this very budget that's the subject of our discussion today. I'm here at Dr. Ghali's request to answer questions, and I want to try and do the best I can to answer your questions. If I don't know the answer to something, I'll find out and find out who you are and get back to you and answer that question. Though I must tell you that as we speak today, there's a great deal of uncertainty. The House of Representatives passed a budget that basically said we're not going to fund Medicaid. We're not going to fund health care as we know it in Louisiana. That was the vote that many members of the House of Representatives were willing to make. It resulted in the great concerns that people all across the state have about medical education, about our partner hospitals, about nursing homes, about the optional Medicaid programs that are vital to so many people. The Senate Finance Committee, which is the next step after the House passes the bill before it goes to the Senate floor, reversed all those cuts for health care. But in order to do that and to find the money necessary to say that we are going to fund health care as we know it, the Senate Finance Committee put the bill in a position that is equally unacceptable. The problem we're having simply cannot be fixed without some replacement revenue for the money that is rolling off the books come July 1. And that should come as no surprise to anybody because we've been talking about this for the past year. We talked about it last year during the legislative session when no revenue measures emerged from the House of Representatives. We talked about it in February of this year when no revenue measures emerged from the House of Representatives. And we were saying, let's not create the very situation that we're in right now. Let's not push ourselves to the brink where there's great uncertainty about funding right before the fiscal year ends. But unfortunately, that's where we are right now. So that's the reality that we have to deal with. And when faced with that reality, what we have seen thus far from the House of Representatives and from the Senate has been the budget product that we're talking about today. The bottom line is nobody came up with a plan that made the necessary cuts that weren't as painful as we suggested they were going to be. You cannot replace the $648 million that is leaving the budget that represents almost $2 billion in matching federal money and expect everything to be status quo. It can't be done. And that's why we're facing the problems we're facing today. The offset of restoring money for health care in Louisiana was to further reduce TOPS funding, to cut $96 million out of higher education in general, to cut every other department in state government by about a fourth when they had already been cut. And the consequences are dramatic. More than 2,000 state employees literally being given a pink slip on July 1. Many services related to economic development and education just ceasing to exist. And that's the tension that is going on. That's the discussion that's going on right now. That's the bad news. The good news is no matter what happens today in the Senate and no matter what happens later this week in the House, the regular session will end on Friday. And the governor has called a special session to begin next Tuesday when revenue can be considered at the same time that the budget can be considered. Because no matter what happens in the legislature today, if it's the House version or the Senate version, that's not going to become the budget for the state of Louisiana. And I'm not sure what the final product will be before this week ends, but my guess right now is that it's not going to be acceptable to the governor. And he will take appropriate action if that circumstance presents itself. But we know we'll be back in a special session beginning next week, and we'll have a chance to raise the revenue. Now, that $648 million represents a more than $400 million decrease in what the people of Louisiana are presently paying in taxes. It's not new taxes. It's not raising taxes. It's replacing only a portion of the temporary taxes that expire on June 30th. And that's what the debate really needs to be about. And we're going to make certain that Louisiana has a responsible budget, one that adequately funds healthcare and adequately saves the medical center in Shreveport and the safety net hospital in Shreveport. As we've been saying all along, it's a top priority for this administration, and we're not going to sit idly by and let healthcare as we know it in North Louisiana or anywhere else in Louisiana fall by the wayside. It's too important a priority. So with that, Jeff Reynolds is with me today. He's the Undersecretary of the Louisiana Department of Health. He's the most knowledgeable person in the state about medical funding and state funding and federal match and how it works. So you have the expert here with you today who I will turn to answer your specific questions. But having said all that, fire away. Please ask us your questions and state your concerns.
Commissioner, thank you. I think I'd like to have Lisa Babin come up and sort of moderate this question and answer session. Commissioner Dardenne, Undersecretary Reynolds, and myself are available to answer any questions that we can. Thank you.
Thank you, Dr. Ghali. As promised early on, we requested that the media send their questions in advance. So I'm going to share a few of the questions and answers that they submitted, and then we will go to the audience for you to pose your questions. I would ask when you pose a question to please stand and speak clearly so that everyone can hear you, and the person answering your question will come to the microphone so that the media can capture the information and everyone in the room can hear. The first question is, if the budget is passed, how soon and residents see the effect? Because the budget is still very fluid, as Commissioner Dardenne alluded to, it will be some time before it's finalized and signed by the governor. We at this time cannot predict the time frame that students and residents will know what the effect on them if an acceptable budget is not delivered. Once the budget is finalized, we will be in a position to share that information. We will obviously do that with those individuals first, but we will then share that information with the community. Understand this is a very difficult time for students and residents, particularly those who are getting ready to start their first year of residency, their first year of medical school, and they're waiting to see if we're still going to be here. So that is a group of people that we need to be very sensitive to.
Let me make one comment about that. Yes, that's the right answer from a quantitative standpoint. Is the school going to be open or is it going to be closed? But from a qualitative standpoint, man, this has been impacting our kids for the past few years. And so we have to stop this yo-yo of every year it's either healthcare or higher ed that's getting cut. So yes, it's already affected our students is the correct answer. And we need to look at ways to mitigate this in the future. And that's what we're working with the commissioner on and Jeff and others.
And there's so many dominoes that are affected if funding is not forthcoming. The state would have an obligation to the residents to make certain that they continue their medical education. And if it couldn't be done here, it would have to be done somewhere else. And so you have an added huge expense that the state would have to bear to train our potential Louisiana doctors out of state where they would become potential doctors in the other state. I mean, it makes no sense whatsoever. And we've got to look beyond just the immediate impact of what these budget cuts mean and look at the long-term impact of what would happen to medical education as we know it and what it would mean for the future of healthcare in Louisiana years from now. So we got to fix this, and we're confident we're going to fix it. It's too bad it's taken this long to fix it, but we think we'll be able to do so when we get back in a special session. Now that the problems have been identified as being as real as they are, and they're not make-believe like some people have suggested to you that they were.
Any other questions related to this while we're on this topic of the impact to students and residents? If so, let's bring that question forth while we're on this topic. Okay. How could the budget affect the partnership with Asha? I think that's pretty simple, but I'll read you the prepared response. Without adequate funding, Asha nor any other healthcare entity will agree to serve as the private hospital partner. No matter how passionate you are about your work, you don't work for free. And if there is no funding, there will not be a partner to come serve as the hospital partner to our academic institution. This has already been seen by the termination notices for non-appropriation that have resulted by partner hospitals in South Louisiana. So if you miss that, Your hospitals in Lafayette and New Orleans have already notified their employees you may not have a job come July 1. So we could look at the same impact. You cannot expect to see a big glowing press conference being held that Ochsner is going to come and be the new partner until this matter is resolved.
Lisa, can I follow up on that?
Yes, you can. Stand up and speak loudly, please, ma'am.
This is for Dr. Ghali, I guess. Has there been consideration of such notices going out here?
Yeah, I can answer from
Commissioner
the
Dardenne.
notices that Lisa referred to are the notices that the private partners sent out. The hospital in New Orleans is operated by Children's Hospital as our partner. They sent out notice to some 2,000 employees that if they don't fix this, we're not going to be able to pay you because we're not getting any money from the state. Lafayette sent out notice to 800 employees. Same situation. A private hospital is our partner operating a state facility in Lafayette. And they've said if we don't get funding, we're not going to be your partner. Because of the uncertainty that clouds the issue in the Shreveport area with BRF and Ochsner, neither one of those entities has sent out any notice to their employees. But I expect that in the very near future, we'll be back here to announce an agreement with Ochsner. We're very close to an agreement with Ochsner. We're very excited about their level of interest, the level of cooperation we've seen from BRF, from the medical school, and that's going to work, and that is going to be a tremendous boost for Northwest Louisiana. But as Lisa said, we're negotiating this deal in good faith with the understanding that we're going to be able to make the payments that are part of the deal. And so when that announcement is made, which may very well be before we complete the special session, it'll be with the big caveat, assuming financing is available, because if the money's not available from the state, nobody's going to come in here and agree to operate the hospital without being paid.
But under the current management, there's not been discussion or talk about sending out notices.
I can't speak for what the private entity is doing, but they have not sent out any notice to the employees.
John Glover. So basically, the state is being held hostage by the House of Representatives and the Senate. Would you not agree?
I wouldn't characterize it as being held hostage because they are the state too. They're the hostage takers and the hostage victims. We're all in the same boat. But what has got to happen is there has to be a recognition by a majority of the legislature, and in at least one case by 2/3 of the legislature, that the funding that is being requested and proposed by the governor is the appropriate way to go in order to solve the problem. What I've been saying for months to people who have said, let's just cut our way out of this problem. The state budget is too big, there's too much fat, let's cut it. Well, this was the opportunity to make those cuts. But in the face of that challenge, what we've seen is the budget that the House passed, which devastated healthcare, and the budget that the Finance Committee has passed, which devastated everything else, and which the chairman of the committee called a pretend budget because it's just not realistic. And so in the special session, when now reality is really about to hit everybody in the face, we're certainly hopeful that the necessary number of legislators will recognize that the right thing to do is to replace a portion, just a portion of the revenue that evaporates on June 30th.
So may I ask a last question, please?
Sure. Doesn't have to be last one, but
Well, we here in Northwest Louisiana seems to be always on the losing end when it comes to equity of dispensing funding. So what can you, in conjunction with the rest of the House and the Senate and everybody else, do other than tell us we need to put taxes on us yet again?
well, there's certainly room for discussion about whether there's been parity and whether there's been a fair amount of money coming to North Louisiana or coming to any other part of the state. That's what the legislature debates every time they get together and talk about how they're going to allocate resources to a university in one area versus a university in the other area, the healthcare in one area of the state or in the other area of the state. There are a number of issues, and Jeff can elaborate on this a little bit, relative to the funding for Shreveport, Monroe, and funding for New Orleans. And they're entirely different constructions of how healthcare is delivered. In New Orleans, for example, we have the brand new charity hospital that was built to replace old charity, where primarily Medicaid patients go and where healthcare is dispensed. But that partner in New Orleans also operates several other facilities that always are not included in the calculation when somebody says New Orleans is getting a disproportionate share to Shreveport and Monroe. And you got to include Shreveport and Monroe together as well, because the partnership up here operates both of those areas. I would just suggest to you that the straight up pro rata comparison that sometimes is put out there isn't necessarily supported by all the facts. And so you have to look at the entire picture of how we fund healthcare. And your representatives and your senators up in North Louisiana obviously do a good job of advocating for what needs to be done up here. And that'll be continuing to be a discussion, believe me, a lot of discussion as we go through the last few days of this session and go into the special session. So Jeff, you want to elaborate a little bit on any of that?
Yes, sir. Jeff Reynolds with LDH. As I always say, anything with Medicaid is complicated as all get out, especially when you're comparing operations in one part of the state to the other part of the state. Part of my job is to make sure it's equitable and we treat everybody fair. But you also, as the commissioner mentioned, the lease payments that hospital that we're receiving on that hospital is much higher than what we're receiving here in Shreveport because it's a brand new facility that was built after Katrina. So those are one of the things. The other things are the acuity levels of the clients. The department has recently done a payment reform study for the hospital program. And based on what we found for the last 2 years, is that for every client in New Orleans, they spend $1.60 because those clients are sicker, and they spend $1.20 here in Shreveport. So for whatever reason, the sicker clients tend to get moved down to New Orleans in that. Then also you've got to remember the services in New Orleans are not all in University Hospital down there. The OBGYN services are at Toro, which is part of our partnership there. So you've got to look at all the services that are sort of spread out down in New Orleans in the southern part of the state and look at what's up here and compare them all together when you're looking at bed days and those types of things. So it is a case where it's not a straight apples to apples comparison. And that's all I would say is that, yes, we consider parity when we discuss funding with all our partners, just not New Orleans and Shreveport, but all of them. They all beat on me on a daily basis about, hey, that's not fair, this is not fair. So it is a case where you've got to look at those details and not just the raw numbers in order to get a true apples to apples comparison when you're talking about the parity between not only Shreveport, New Orleans, but all the partners.
But did you take that into consideration when you all built the new structure and then dispersing everything in and outside of that structure? Because here in Shreveport, primarily everything is pretty well centered. But why in New Orleans, if you built such an astronomical structure, did you not deal with that particular aspect of it?
Well, and I would defer to the medical professionals and Dr. Olia down there, but I know, Toro had a big OBGYN program and they did not want to duplicate services in that new building and the overhead and everything else. So they thought it was more cost effective to have some of that stuff housed outside that brand new building. And it is a case where, depending on the model, Shreveport here is a UCC dish model. The department pays all of its uninsured costs and all of its Medicaid costs, so all the care for the Medicaid, we pay the government. Monroe is a UPL model, so we're able to make additional payments over there to help offset some of the costs here in Shreveport. So you've got to look at both facilities and the payments at both facilities before you say, oh, it's support. But then I would say, well, are you looking at them all together, not just individual facilities? And it is a case where New Orleans has had historical higher costs when the prior partnerships came in, that big old building. So there were some built-in costs that got incorporated into the current partnerships. But as we go through the process, it's always a case where it's renewed every year. We looked at that, and with the expansion, we are seeing all of the supplemental payments for the hospitals to come down and become. And that's the goal, is to get off of these supplemental payments. If the clients go and provide the service, or the providers provide the service at the hospital, they get reimbursed at fair rate by Medicaid. So it is something we're considering. but it is very complicated, and we've got to look at all those details.
Thank you.
Thank you, ma'am.
And just to add to the complication, any of us know just from our own personal experiences how complicated healthcare funding is. When you go to the hospital and you see these enumerated bills and you've got the proverbial $30 aspirin, or whatever it may be, these inflated costs for services that are rendered and supplies that are rendered is indicative of the problem we have in trying to fund healthcare in Louisiana. Jeff mentioned a couple of things just because he's so used to talking in the acronym world, DISH and UCC and UPL. Those all are separate funding mechanisms. They're a part of how we patch together our ability to draw down federal funds, to maximize drawing down federal funds with state general fund dollars. But it's those state general fund dollars, your taxes, income taxes, sales taxes, what all of us pay, that are the match that has to be put up in order to get those much larger federal dollars. And so it is a very complicated process and a very confusing patchwork of ways to fund healthcare, but it's the world we live in America with our healthcare delivery system, and costs constantly going up, constantly increasing, even though we don't necessarily factor in inflation to the needs that state government has. We can't ignore the reality that it's there. Yes, sir.
I'm James Green. My question would be, have you approached the legislators about having a session on amending the Constitution so that healthcare and education wouldn't be the only department that they pick on? All they got to do is get them to come together, get the constitutional amendments, give them to the voters, we vote on it, and then therefore you could take a percentage from the whole shebang versus every year healthcare, every year education. So why the people that we have in Baton Rouge, I'm not a genius, but they are, why would they just think about, let's just have a session to amend the Constitution that we wouldn't just pull all the money out of education and health?
You express it very eloquently and you make it sound very simple. Unfortunately, it's very complicated, and here's why. But the answer to your question is yes, that's a big topic of discussion right now. The process of amending the Constitution.
You said it's a topic of discussion. How do we move it from the topic?
Well, I'm going to tell you, because it's just like how we resolve the budget debate. It's votes in the legislature. The Constitution, to call a constitutional convention requires a 2/3 vote of both houses of the legislature. If that happens, and the governor can't veto that, it's an amendment to the Constitution. So if the legislature by 2/3 vote says we want a constitutional convention, the process then begins. The bill that does that would have to set forth how you select the people who are the delegates to the convention. That's a huge topic of debate at the Capitol and was this past week. How do you pick the delegates? Is it by Senate districts? Is it by House districts? Is it by some other configuration of the state? How many legislators, if any, are involved in that? Does the governor get any appointments? Do special interests get to name certain people? How do you pick who's actually there? That's a big part of the debate. Then you've got to actually elect those people, because presumably there would be an election to have the delegates selected. So you'd have to choose the methodology of delegations, have the election, have the convention, and then have it voted on by the people. That is a long process. That is at least, I think it's probably about a 3-year process, being realistic with you as to how that would work before it got to reality. Right now, our reality is staring us in the face on July 1. So it has not been the governor's priority to say, let's have a constitutional convention. He's said that he's not necessarily against it. He just doesn't want that to be an excuse to not act anymore. We've kicked the can down the road. I told the press club in Baton Rouge yesterday that Louisiana could be the all voting members of the American Association of Can Kickers, because all we've done is kick our problems down the road and save them for another day. And we can't do that with this fiscal crisis we're facing right now. Now, having given you all that commentary, there were several bills in the legislature this year to do just that, to call a constitutional convention. They failed to get the 2/3 vote in the House of Representatives, and therefore the bill right now has no life. There is going to be a study, I think, of how you would go about doing this, because that's what the legislature, and I was there for 15 years, always does. When they don't have an answer right away, we study it. And we've studied things to death. We have master's degrees in how to study problems in Louisiana. We just don't have a doctorate in how to fix them. But the notion of the Constitutional Convention is not going to go away. I think it will be a big topic of discussion next year when we have statewide elections. And I think sooner or later, in the very near future, you're going to see a constitutional convention, but it won't be this year because the House of Representatives has already spoken and they couldn't get the 70 votes necessary to call the convention.
Two things. One is, how impossible would it be to get a list of the legislators that voted against it? And two is, as you just stated, how hard it would be, then how can we simplify it? Because we say, we got to do this, but then once you start looking at how many people are going to be without health care, and how many people are going to be without their funds to do whatever, and then higher education is going to be cut. So basically, you tell me how hard, but give me the simple part. And then getting a list of the people, the legislators that did not vote for it. And then you can pass it on to their district because they possibly don't know. And so therefore, they could easily be replaced. And then that last thing is that the committee that did all the, I know they had a committee to say, well, we just do healthcare, do education. I know they got a committee that was over that. Give that committee that task as to getting the Constitutional Convention together, and I think we would have it all lined up.
Well, you use that word easy again. It's going to be easy to get rid of those people who didn't vote for it, but that's a whole nother process when people vote next year as to what they think. I think the bill, I'm not sure, check this, I think it's House Bill 500, and you can go online at the Louisiana Legislature's website and see the exact vote that was cast. I wish I could tell you that it could be made easier, but I got to be honest with you, and it can't be. The Constitution of the state dictates how we amend the Constitution and how we replace the Constitution. So you have to go through that process that it sets forth, which involves the 2/3 vote of the legislature, a convention to totally rewrite it. The legislature can always amend the Constitution, and the people get to vote. And every time we've had a chance to vote, the people of Louisiana have dedicated more things. Every time the legislature gives you a constitutional amendment, we, the people, have said, good idea, let's dedicate that, because through the years, the people have not trusted governors and legislatures to do what they wanted done. As recently as 2 years ago, there were 2 more dedications put in the Constitution for health care. And that just seems to be the way people have voted. But the issue du jour, the issue today is how do we fix this budget in the next 30 to 45 days and make sure that the kind of devastation we're talking about doesn't happen. And that can be done by legislators without even thinking about the Constitution. It's just a matter of recognizing what the priorities of this state are and recognizing that you can't, as a legislator, vote for temporary revenue that expires at some point in the future and not expect when that revenue rolls off that somebody's not going to say, what are we going to do now? And the what do we do now is you replace some of that revenue. This is what we're saying. Don't replace all of it. Replace 648 million of it. That's what's needed. And say goodbye to 1.4 billion of it. And by anybody's math, that means we're all paying less than we're paying right now. And then we're still able to get the kind of things we think are important, services we think are important.
Thank you, Commissioner Dardenne. We're going to move on to some other questions that we've committed to answering, and this falls right in line with that. Have conversations between state lawmakers and LSU health leaders been fruitful? We could debate that one at this particular moment. But we do believe that our legislators have been supportive, but they are constrained by the current lack of funds to meet all the needs in the state. We've been very forthcoming with our legislators, just as we are attempting to be with you today regarding the outcome of a budget that cuts health care and higher ed. We have and we will continue to work with our legislators through the remainder of this session and going into the special session to inform them of the funding that is required to minimally, as Dr. Ghali alluded to earlier, there is a big difference between surviving and thriving. At this point, we've just got to make sure that we survive, and then we will work in moving forward on the thriving. We do believe that based on the affordable and effective education that we provide to our students, the health care provided by our faculty, as well as the resurgence of successful awards for our research programs and our overall impact to the economy, more than ever, legislators have to understand that LSU Health Shreveport must be a priority for funding. There literally is no one else in this community that delivers the full complement of an impact to the budget, affecting healthcare, keeping our brightest students in the state by giving them the opportunity to attend one of our 3 professional schools. And we do believe that our legislators understand that. Your presence here today will hopefully remind them that there are many who feel that LSU Health Shreveport is a priority for funding. What do you want us to tell lawmakers considering the passing of this budget with these sort of extensive cuts? If you're interacting with a legislator, we're going to keep it simple. Tell them, don't even think about it. We can't take any more cuts. We have been very, very faithful stewards of the limited state dollars that have been entrusted to us. At this point in time, only 18% of our $302 million budget is comprised by state funds, but we need every dollar of those. And if entrusted with those, we will continue to be good stewards. As shared earlier, we are remaining optimistic that our legislators, who repeatedly say publicly that they value LSU Health Shreveport, will vote to back up the statements that they make on an ongoing basis about our institution. Paint a picture of how dire this situation is for LSU HSC. As Dr. Ghali has alluded to, it would be catastrophic. If the budget in hand were to move forward, LSU Health Shreveport, as you know, it will no longer exist. So it's simple. I mean, there's not a lot of flowers about it. We have to maintain the same level of funding that we have at this time. If an amendment budget is passed and more funding.
Are there any questions at this point? Does anyone have any questions at this point?
Any questions from the floor?
Lisa?
Yes.
I have one question, and this is to Commissioner Dardenne. We're talking about big money. We're talking about, what, 674 million?
648.
Yeah, well, anyway, it's good enough for government work. What about the departments of all of the departments in the state of Louisiana? What would be wrong with asking each department head to cut 10% of non-essential personnel and thereby save a lot of money? Right now, you've got some supervisors supervising one person. So what would be the chance to do that?
I want to see the list of people, supervisors who are supervising one person, because I'm looking for that as well. But the answer to your question is we have cut other areas of the budget and cut them dramatically, and it will continue to do so. But remember what I said about state general fund. The state general fund of Louisiana, the current year is about $9.6 billion. That represents what all of us are paying into the state general fund. It's going to go down to about 8.6 next year. We've made up some of that because of the changes in the federal laws. But of that state general fund, about 85% of it is already spent. It's dedicated to K-12 education and certain areas of the Medicaid budget that we have to spend money on in order to make sure we continue to get Medicaid. So that just leaves 15% of the state general fund that you can cut that services everything else. To make the kind of cuts that you're talking about is what the Senate committee did when it cut everybody else 24%. And even if you knock that down to 10%, you have devastating results in many other areas of the state government's budget. So it's not like that money is just being spent somewhere else frivolously, and we could just simply move it around to this healthcare budget. That's not the case at all. And that's I think a belief that some people like to say is out there that's just not real. It's just not correct. And this administration has been about as honest as anybody has ever been in terms of the transparency of how we budget and looking at what we've done. And I'll just add this, when it comes to that aspect of the budget that goes to healthcare, our partnerships with the hospitals, the thing we're talking about right now, they have contracts that they entered into with the state under the previous administration. Those contracts are very favorable to those partner hospitals and not nearly as favorable to us, the state of Louisiana. We came in and have renegotiated those deals with our partner hospitals, the BRFs and the Lady of the Lake in Baton Rouge and Children's Hospital in New Orleans, and have been able to negotiate reductions in what they're received by the very language of those contracts, because they've understood our plight and they've been willing to continue being our partners. So we've already cut our partnerships over the course of the past 2 years, and they've been screaming bloody murder, as you can imagine. And those cuts have not exceeded 6%, but they've been around 5-6%, sometimes a little less. Can you imagine if we came in and said, as the House budget did, well, we're only going to fund you to the tune of about 50% of your budget. You could take a 50% cut or a 40% cut. They're all gone. And they've told us that. And they've told us that by giving us these termination notices. So we have an obligation to continue these relationships to make certain that we have a safety net hospital system in Louisiana, and one that's taken advantage of the ability to draw down Medicaid dollars to care for the poor in Louisiana, because unfortunately we have a lot of people below poverty in Louisiana who are dependent upon those services. Yes, ma'am.
Hi. Looking at the roll call vote for HB1 in the North Louisiana delegation, all the Democrats and 2 Republicans voted against HB1. What about those that voted for HB1, the doomsday budget? Basically, why would they vote to end University Health Shreveport as we know it? Why would they vote against it?
Well, I'm not the person to ask that question to, obviously. You have to ask it of those individuals who voted for the budget and were willing to say that they thought it was a responsible budget. The chairman of the committee, who's not from North Louisiana, said it was a responsible budget. And several members have talked about that we need to cut the budget. We don't need to raise any new revenue. Well, this was their chance to propose amendments to cut the budget in a way that was responsible. And we didn't see any of those amendments offered because they can't do it. It's what we've been saying all along. You cannot fix this problem by pretending that the money is there. You have to fix the problem by replacing a portion of the money that's falling off the books. But you have to ask those individuals why they voted the way they did.
You know, I'll just say that that HB1 results in a 55% reduction of funding for our health science center. You know, that's not sustainable. We would have to close our entire health science center.
Yes.
My wife's been an employee of the medical school for 10 years now. So we've lived this roller coaster every year in our house. You know, right in this time of the year, wish you have a job. And I've also watched the partnership with BRF, and I was wondering how much money do they still owe the medical school?
You want me to give that figure? So, again, as you recall, I want to say it's July of 16, I believe it was, that we negotiated an amended or an MOU to the physician service agreement. But the sort of in a nutshell, right now we're owed $30.3 million.
Okay. The reason I ask that is I get press releases all the time, and if BRF is about to get out of the hospital business, they just received a $30 million loan from White Oak Healthcare Finance less than a month ago. And I was wondering, are y'all going to receive payment?
Well, I will tell you that as part of the closing of this process with the BRF, University Health, between the state, LSU, Oshner and BRF, there is going to be an agreement whereby the funds are paid. Yes, that's part of the closing process. It's still being negotiated. The details of it are still being negotiated.
I just thought it was odd them taking out a loan this late.
Right. And I'm not sure, again, you would have to ask the BRF whether it was actually taking out a loan or just refinancing a previously existing line of credit. That's not, you would have to ask them because I don't know the details on that.
Thank you.
But I appreciate your concerns.
My understanding is that it was a refinancing of an existing line of credit, so it wasn't an infusion of new money that hadn't been there before. And as Dr. Ghali said, this is a big part of the discussion that's underway right now as we try and transition from BRF to Oshner and determine how much money is actually owed to creditors, to the state, and we try and resolve that as part of this deal. And as I've said before, I'm very optimistic that's going to happen. BRF has been very cooperative as we've gone through this process. Ochsner has been very excited to see the potential that they believe exists in North Louisiana. And this new partnership, this new relationship is going to be very successful for the state, very successful for all of you who are concerned about the medical school and concerned about the delivery of health care in Northwest Louisiana, the Shreveport, Monroe area. And I believe it's going to happen in the not too distant future. We're very optimistic about where we are with this discussion.
Okay, let me wrap up with just a few other questions that we committed to the media who sent questions in advance. So thank you for posing that one. That's the reason I had the answer, is that was something that the media had asked about, what was the current status of payments owed by UH. We have got several questions from the media. I think there is a lot of interest of exactly what is the Ochsner partnership going to look at, because it has been discussed as being a different type of partnership than we currently have. And while we won't go into a lot of detail about that yet, it's obviously premature. We're not there yet. But I will share that Ochsner has spent a good bit of time looking to see where they would make their capital investments, because there's concern about, gosh, we need to see some infusion, some expenditures going in to improve the hospital. And they're basing the investments that they will make on improving quality outcomes, safe patient care, and support of cutting edge medical education, because obviously we want our students to be training on the latest technology. So they will be looking at those specific areas. And when an agreement is reached, more details along that line will be shared. They do intend to continue sharing services such as university police, utilities, anything that makes sense. Despite, there's a lot of positive talk, and we expect it to be very positive, but don't think that Ochsner is not looking at every single dollar and how they can be most efficient, because as Jay alluded to, and Jeff, there's always changes in healthcare reimbursable. So anyone who runs a hospital has to be very cognizant of every dollar spent, and that will be no different with Ochsner. The agreement will be structured to reflect payment to the Academic Medical Center for fair market value for the services provided by LSU Health faculty in the hospitals and clinics. It seems like, we're kind of getting up the learning curve with everyone understanding that all of the services provided in the hospital, whether it's University Health or Ochsner, will continue to be by LSU faculty. So that's one thing that will remain consistent, is that LSU Health faculty will be providing services in the hospital. So are there any additional questions that have not been addressed? Yes, sir.
One comment, Mr. Commissioner, I just want to thank you for your tremendous support for healthcare in North Louisiana and our medical.
Thank you.
I'm sorry, who am I missing?
Mr. Thorne, we've been down this road about 4 years ago when we talked with UH. My question to you is, I hope you all are looking very closely at the partnership you're trying to do with Ochsner, because as you can see, 4 years ago, this is what has happened, and it has caused a lot of state employees to lose a lot of benefits. So I hope you all are looking at making sure that we're making a good decision. We're not rushing like we did before, because we did that in a couple of months and a lot of blank pages. So this time, I wish you all would take a closer look at that, because that was a real quick deal that was done. It wasn't something that took months or years to do. We did that like really quick, and I thought that was really kind of fast.
Yeah, the question, if you couldn't hear it, was hoping we're going to be looking very carefully at the new partnership with Ochsner, because the last one was done pretty hastily. And of course, that's correct. It was, and that was not our agreement. This is one we inherited. We inherited all these deals with these public-private partnerships, and we've made them work, and we're going to continue to make them work. The charity hospital system, as we know it, was cast aside in order to go into the public-private partnerships. It's proven to be pretty expensive. Because frankly, as I said earlier, these deals were not advantageous to the state. The deals were hastily approved, and unfortunately, we have to live with them, and we have negotiated modifications to them. Obviously, we're looking very carefully at this arrangement with Ochsner, and Ochsner is looking very carefully at us. I mean, this is a business relationship that a very good private business, Oshner, is looking on, embarking on. And we, the state, are looking to make certain we protect the taxpayers of the state, but also get the best possible health care and best possible arrangement we can for the state. And I think at the end of the day, we're going to do that. And we're going to strike a deal that's fair to both sides and is reasonable to both sides. But all these partnerships are different, and we've had to treat each one of them differently. But I know this. The health care overall for the people of Louisiana is much better today than it had been previously. And I say that across the board overall, because we've put a focus on clinics and primary care and preventive medicine that wasn't there in the charity hospital system, because all they were doing was running a hospital system. Now our partners are focused on trying to identify people from a primary care standpoint to keep them out of the hospital and to keep them away from the emergency room where it's much more expensive. And that's our ultimate goal, is to have the money for Medicaid in particular follow the patients. Where the patients wind up going for services, that's where the money ought to go. And eventually, I think we will get there. That's sometime in the future. Right now, we have the partnership arrangements that will continue in the immediate future, but way down the line, the ultimate goal for the secretary, for the undersecretary, is to have the money follow the patient.
Are we working on a deadline, or do we have a time frame?
We do have, well, we have a target date of the beginning of the fiscal year, which is July 1. And that's why I say I hope you're going to see an announcement before that time.
Dr. Ghali, one last thing. What is your message to staff and employees today?
Well, my message is to hang in there, and many of them know me pretty well, and it's really a global message. You know, anyone that knows me pretty well for quite a while, whether it's Marquis or Lisa or Matthew Saint Amant or any of these folks, Joe, man, I mean, first of all, parity. Parity goes away when you quit, when not everybody gets the blue ribbon all the time, after the fourth grade. But the reality is that if you know me, you know that if I think that there's not any parity up here, I'm gonna be the first son of a gun to be jumping on someone's rear end about it. So if I'm not jumping on somebody's rear end about it, there's got to be a scholarly reason why there may not be parity. And as Roxanne has kind of taught me, Medicaid is a cost-based reimbursement model. There has to be certain amount of expenditures and costs that have to then be counterbalanced in order to get matching federal funds. It's a very complicated process. And for example, in the New Orleans model, just merely the depreciation of a brand new facility. Joe can tell you, depreciation of a new parking garage, a power plant, the fact that they have more employees, the fact that they have more residents and trainees. These are all things that can be added onto the Medicaid cost report to then get matching funds. It doesn't mean that we won't get there someday, we will, but there are legitimate, logical reasons. Don't believe everything that you read at necessarily at face value. I'm all about North Louisiana. So my message to the faculty and the students is that we're going to not just survive, we're going to thrive. And we've put together a leadership team here that's unbelievable. I mean, think about this. We're geopolitically isolated in North Louisiana. We're able to get people like the commissioner, the undersecretary, the governor. The governor has probably come up here more in his 2 years than the last 3 or 4 governors combined. Steve Scalise came up here, took out of his busy schedule. I mean, we have value and we have relevance, but unless you guys get out and talk to your representatives and senators, it's going to fall on deaf ears. So, that would be my message. My message to them is to get involved and know that your leadership team has your back 100%. The most important aspect of this is that we want our children to come back to this community here, and we have to take care of the less privileged folks. And the only way to do that is to help support our legislators in making them think the right way. Otherwise, they think they're doing the right things all the time.
Dr. Ghali, final question. Do you think the whole deal is going to shut down? Are we going to lose everything by July 1?
No, we're not going to lose anything by July 1 because we're going to find a way to make sure that we continue to take care of the patients. But it won't be optimal unless the plans of the administration are followed. I can tell you, if you look at HB1, it's going to be a 55% cut to our health science center. We have a $325 million operating budget. Over 50% of that will be reduced because the enhanced funding that is achieved through these models, through the Medicaid models, are what is responsible for a good 50% of the funding of our health science center. So, we're going to find a way to keep certain services open. We're not crying wolf, as I said in the legislature. We're really crying uncle. We need some help.
And let me say this. I won't answer any of the questions if any of you have questions, but would say this if we're closing. This is a political process. There is no question about it. I mean, this is what happens in the legislature and what happens with confecting the state budget. And there are varying philosophies in the legislature, obviously, and we have said repeatedly, we respect that. And we understand that some people say, I'm taxed enough, I don't want to pay any more taxes, period, end of discussion. And to those people, we have said, tell us what you don't want to do in this budget if you don't believe the replacement revenue ought to be manifested. And nobody has been able to come forward and say, okay, here's where I'll make the cuts, and we'll still keep all the health care open, and we'll still fund TOPS, and we'll still fund higher education. The challenge is to say to people who are just saying, no, I'm not going to vote for anything, what is it you're willing to sacrifice in the budget? And we just haven't seen that yet. And we're not going to see it because you can't reach these kind of numbers with that kind of talk. You have to be able to find specifics, and they're not going to be able to find specifics. So the time has come to say, we're willing to replace a portion of the revenue that rolls off so that we can continue to make certain that this medical center thrives, that we're training physicians in North Louisiana, that we're providing health care to people in North Louisiana. And that's where we are right now. And that will be the focus of all the discussion when the special session begins next week. And I encourage you to be involved and voice your opinion no matter what it is, pro or con. Legislators ought to hear from you. I spent 15 years in the Senate, and I valued input that I got from individuals who called me, who wrote me. So it's kind of before email was as prevalent as it is now. But that's the way you communicate with people. But you ought to let your voice be known to the people who represent you as to how you feel about this. And your presence today is very important. We appreciate your coming out and participating in this and giving us a chance to tell you what's going on and what the process is going to involve. So if you don't have any more questions, I thank you for being here and appreciate your attendance today.
You have, and the governor has threatened to shut down LSU football and to cut everything else. Is it just scare tactics? Are you guys serious about this? And why do you pick on sacred cows?
Well, we don't pick on any sacred cow. We tell the truth about where we are in the process. The supposed comment about football a couple of years ago, I won't comment on because I would not have wanted to cut out football under any circumstance either myself, I must say. But what is going on right now is not scare tactics, it's reality. And this is what we have said, particularly as it relates to the way the House budget was passed. The leadership in the House came out and said it's a responsible budget, said this is what we can live with. That meant half the legislature said it was willing to eviscerate health care as we know it. We are obligated to tell Medicaid recipients who are eligible for certain programs that they may not be eligible for those programs anymore. Those are the only people within the million that receive Medicaid services that got a notice telling them you may lose these benefits because we have to reassess your eligibility. Somebody may be contacting you to find out your financial situation, and because we have to start the process of emergency rules. And frankly, we debated this for a long time to decide what was the right thing to do and the right timing to do. And we concluded it was not right to tell somebody 10 days before they may lose their place of residence, be aware you may have to go. We felt like we had to put people on notice that something may happen because this process is underway. And that's why that was done. Yes, ma'am.
Is that budget available to the public?
What,
I'd like to see
the state budget?
you're speaking
Oh,
of.
sure. It's House Bill number 1. And then you'll see it in various stages with confusing words like engrossed and re-engrossed. And
So that's why we don't understand what you all are doing?
yeah.
Okay.
No, that's not why that's why those are. I don't know why those words were used, but it's confusing when you see words you're not familiar with, and it just means every step of the way it gets a different identity. Engrossed, re-engrossed, and what have you. The final act is what you're really going to be interested in. That's when everything settles down in the special session.
So,
Yes, ma'am.
I guess you know what I think on any given subject.
I do.
I want you to deliver a message to the governor, and we appreciate him keeping up the heat. He inherited this mess. He didn't make it. I'm Republican, but I'm all for this subject.
I'm one too, and we're fixing this. And I'll take it down the road. I'll tell
You
them.
better pay lock a few people up.
And, you know, before we end here, I was just, in answering Mr. Pace's question a minute ago, he asked about, you know, is the school imminent to close? The reality is that I'm damned if I answer it one way, I'm damned if I answer it the other way. Okay? If I tell you the truth and say that no ethical person, no ethical governor would ever allow closure of safety net services, then those individuals, and again, I don't care if you're Republican or Democrat, it doesn't make a rat's to me. Those individuals that aren't going to vote in the correct direction for funding are going to not vote because they think it's going to, you know, they're never going to close it. Let someone else get the heat for raising taxes. I'm not going to do it. That's the reality of the situation. And anyway, if you want to quote me or not, that doesn't really matter.
We're not raising taxes, we're replacing revenue.
Replacing revenue, or, you know, you're correct. But I think you know what I'm talking about. So I want to thank everyone for being here. If there's any other questions for Undersecretary or for the Commissioner, please ask them now, because I'm not going to let anybody attack them as soon as we're done. And then, because we're on a fairly tight schedule. As you know, we're an agency of the state. We cannot lobby. We do not lobby. We're not telling people how to vote one way or the other. We're only telling the consequences of what happens if you vote one way or another. And so our LSU Health Foundation president, Kevin Flood, come up here, Kevin. He wanted to make a comment or two, and then we'll be done. I think, Reverend Green, you need to get the commissioner on your radio show.
Reverend Green needs to run for something.
Thank you, Dr. Ghali. I'm Kevin Flood, president of the LSU Health Foundation. And so we're the private organization that raises private support. So every day we advocate amongst the private sector to support the Health Sciences Center. We're not about lobbying either, but it was mentioned earlier, and I've heard Dr. Ghali talk about it, that it's this surviving and thriving notion. And we at the foundation mainly deal with the thriving. We're about achieving greater excellence at the Health Sciences Center and our partner hospital. But today we're faced with surviving, and that's sort of a scary thing. I think everyone in this room understands what the asset is that the Health Science Center is to this community in our partner hospital. There's no question about that. I think that's why you all are here today. And I don't think there's any question that our legislators understand that as well. But just to make sure that they hear us loud and clear, there is a petition on the way out that just simply says, fully fund us for this coming fiscal year. Just give us the minimum level of dollars that we expect to have, and to make a prudent choice and to choose LSU Health Shreveport. So if you would, just on your way out, if you wouldn't mind signing that petition, and we appreciate it. And again, thank you all for being here today. I don't know if there's any other comments.
Thank everyone for coming, and I just want to extend a special thank you to the media. We rely on them very heavily to share the great things that are happening at LSU Health Shreveport, and we are relying on you very heavily to help us get this message out about what a critical time this is for us. So a huge shout out and thanks to the media and to each of you for being here today. Thank you.